Hi, nurses. Welcome to Shift Change, the podcast for nurse leaders who are ready to shift their thinking from just a nurse to claim their position as a powerful agent for change. I'm your host, Amy Deagle, founder and CEO of the International Network of Nurse Leaders. We believe in the power of nurses to change the world, so let's get started. Hi, nurses. Welcome back to another episode of the Shift Change podcast. I am so excited to have you here with us today. As always, if you would take a couple seconds, if you're listening on Apple Podcasts, and scroll down to the rate and review section and just leave us a rating or a review, we would so appreciate your feedback, and it just helps us keep producing this show for you. So today I am thrilled to bring you Dan Weberg. He is a guest from the United States, and we have a fascinating interview for you today. But before we jump into that, I just wanted to chat for a minute about Year of the Nurse and Midwife, which the World Health Organization has designated 2020 as. And it's really important that we're not only celebrating each other and celebrating our achievements, but that we're not just letting this year go by without actually doing something. And so here at the International Network of Nurse Leaders, I've created a 3-part free video challenge to get you into activity and to really start using leadership in a way that's going to create some positive and lasting change. Now, I know some of you are thinking, oh, I can't even fit one more thing in a day. I barely get time to eat, let alone go to the bathroom in my shift. How am I supposed to be a leader? And I promise you that these things and challenges that I have for you are super easy. They are small steps that you can take right now, some of them in less than 30 seconds, that will start the tides of change. So I know that you are all busy. I know one more thing might make you feel like you're going to drown. And this isn't meant to paralyze you, but it is meant to get you into action. Baby steps towards change is what's going to make the difference. Because an action step, regardless of how small, if it's repeated over and over, that's the key to lasting and sustainable change. And the truth is, nothing is going to change if no one changes. So you need to start thinking about how you can impact the nursing profession, how you can make 2020 Year of the Nurse, so that in 2021, things are actually different. This is the year to move our profession forward. I really hope you'll join us. If you want more information, you can jump over to nurseleaders.ca/2020nurse. That's nurseleaders.ca/2020nurse for all the details. And we are going to get to the episode with Dan. Dan Weberg is an expert in nursing, healthcare innovation, and human-centered patient design with an extensive clinical experience in emergency departments, acute care inpatient hospital settings, and academia. He currently serves as the head of clinical innovation for Trusted Health, the staffing platform for the healthcare industry, where he helps drive product strategy and works to change the conversation around innovation in the healthcare workforce. Prior to joining Trusted, Dan spent 7 years at Kaiser Permanente, where he held executive roles in nursing innovation, research, and technology strategy across 8 regions, 38 hospitals, and 60,000 nurses. He was also part of the founding faculty for the new Kaiser Permanente School of Medicine. Dan is on the faculty at the Ohio State University College of Nursing and multiple innovation fellowship programs. He previously taught on nursing innovation and leadership at Arizona State University. He is on the editorial board for the Nursing Administration Quarterly and has authored 24 peer-reviewed articles and 2 textbooks, including Evidence-Based Innovation Leadership for Health Professions and Leadership in Nursing Practice. We are so thrilled to have Dan here with us today. Hi, it's Amy. How are you?
Hey, good.
Good. Does it still work okay now to record the podcast?
Yes, this works. Yeah, for some reason, your number comes up as a telemarketer on my phone. So
oh, because I'm calling for Skype, because that's how we record. Yeah. Oh, I'm sorry.
It's all good. I was like, if they call back, it's not a telemarketer.
Yeah. Until they catch on that that's what we're doing to all of them, and then they're going to start doing that.
Totally. Oh, yeah, I'm sure.
All right. So I got your bio and all that sort of stuff. So did you have any questions before we get started, Dan?
No, let me put on my headphones really quick. So I'm not holding the phone and it doesn't make all that noise. And then I think I'm good. I looked over some of the questions and so we can just make it happen.
Okay. And we might not get to all of them. It kind of just depends on how the interview flows and goes. But we will definitely, like I said, wrap up with those last two about the tangible takeaways and a story. So.
Okay. No, that sounds good. Let me just close this door. I'm working from home today, and my wife is also working from home. And when we're on the same calls together, it's loud. So. Okay. All right. I am ready whenever you are.
Awesome. Okay. So basically, I've already recorded the intro and your bio. So we'll pretend like you just heard me read your bio. And I'm going to welcome you to the call. And then we'll start with that first question about your nursing career and just the journey that you've had thus far. There is no rush on that piece. So take as long as you want to dive into that. Because then I'll be able to pull some questions out of that as well. And I've got us scheduled for an hour. So we'll try and keep it to that and just see how it goes. If it wraps up sooner than that, that happens as well too. So, but I just kind of like perfect. To give people kind of a time frame. Okay, so yeah, I'm just going to start the recording, and you'll hear me welcome you to the call because I'll pretend have just read the bio.
Sure.
Okay. All right, so welcome to the Shift Change podcast, Dan. We are so excited to have you here.
Yeah, thanks for having me. This is great.
Awesome. So as you know, we love to hear about the nurse leaders that we have on this podcast journey and how they started in nursing and how they got where they are today. So would you mind taking us through what your nursing career has looked like thus far?
Yeah, sure. I didn't know I wanted to be a nurse until I was in college at Arizona State. I was sitting in my economics class and realized I had no desire to work in a cubicle the rest of my life. So I did some soul searching over the last semester there of my freshman year and decided I wanted to go actually pre-med. And so started taking all the pre-med courses, and they kept telling me to have a backup. And so I was like, oh, my backup will be nursing. I don't know what nurses do, but it sounds like a good backup. And started going through the pre-med stuff and was just like, this is not the culture for me. I'm not the gunner. I don't really resonate with the coursework. And decided to stop the pre-med stuff and actually go full bore into nursing, and got in. And from there, just fell in love with the profession, the work, and the whole healthcare system. I graduated and started as a new grad in the ER at UCLA Medical Center and worked there for about a year before being hired back to Arizona to help Arizona State build their nursing simulation program. And at the time, the simulation was just becoming part of the training regimen for nursing schools. Their sim man was in a box. They didn't know how to use them. And part of my senior project at school was to learn how to use sim man. So they actually hired me back to teach them how to build a sim center. And so I did that and continued to work clinically as an ER nurse. And then my colleagues had said, hey, you need to do this innovation program. You're into simulation, do this innovation program that ASU was just starting to create. So sure, I'll apply for that. And I got into the Master's in Healthcare Innovation program, ended up being in the first cohort to graduate with that degree. And I came out, and I remember sitting at the final in-person session, and they're like, hey, we created a PhD program. We need people to apply. And I was like, oh, I'll just do that. That sounds good. So I applied, and I was the only one that got in. So I was the only student in the innovation track in this new PhD program at ASU, which was a blessing and a curse, but got to be connected with some of the biggest healthcare leaders and nursing leaders in the country as mentors. And so got to be the first graduate of that. And as I was going through that coursework, I just really fell in love with kind of the leadership curriculum, the science of leadership and change and innovation. Was able to hold a couple positions within the College of Nursing while continuing to work clinically. And then the dean of Arizona State decided to go over to Ohio State and brought me with her. So I got to go move across the country. As a California native, I moved to Ohio. I didn't know where Ohio was on a map until I drove there. But ended up being the director of nursing education for the 5 hospital system at the Ohio State University Medical Center, which was amazing, and helped revamp their orientation program. And all the service line educators ended up reporting to me, and got to do some changes across all the different specialties. And then got a random email out of the blue from a colleague who said, "You need to have my job." And I said, "Well, that's interesting." And she said, "I'm the director of innovation at Kaiser Permanente." I was like, "What's Kaiser Permanente?" But I like this innovation stuff. And she's like, "Just get on the phone, apply, and we'll see what happens." Ended up applying and had a phone call. I remember I was at my wife's grandparents' house the day before Thanksgiving doing a phone interview. At the end of the phone interview, they said, "Hey, we're going to bring you out." So it's like December 10th, I think, flew me out to California and did an in-person interview. And on the way back to the airport, they were driving back and they said, "They'll have an offer on Monday." And so I got to then be the director of innovation for Kaiser Permanente on kind of the emerging technology side. And I spent the last 7 years at Kaiser Permanente in various leadership roles, helping with strategy, helping with technology, leading teams. And then decided my 7-year itch was needing to get scratched, and ended up joining a startup called Trusted Health, which is a innovative kind of workforce management, nursing workforce management company. And I've been there for the last 3 months. So that's kind of the career trajectory. And on the side, I've written textbooks, and I still teach at Ohio State. I wrote the curriculum for their master's in healthcare innovation program, and always like to have my hands in multiple things, but that's kind of a high level overview.
That's incredible. And so how long have you been a nurse then, Dan?
I think this is my 13th year.
Wow.
So, not very long.
Not very long. That's incredible. So I had a guest on a few months ago who had said, as a man in nursing, he was expected to go into the leadership track and to be finding out, how to advance his career on a really fast track. Did you find a similar kind of attitude towards that, or was that something that you really took on yourself because you had an interest in leadership?
For me, it was more of an interest thing. I've heard similar stories, and I think the actual stat is like male nurses end up getting to the top of the profession, whether that's a chief nurse or some, executive leadership role within like 7 years of graduating from nursing school. So it's really fast. But for me, it was more grabbing what interested me. I never really had a plan. I just took opportunities that presented themselves and did them. So I didn't really feel forced to move up the ladder, but everything I chose was really interesting to me. So I think that was more of the driver.
Hey nurses, I just wanted to take a quick break from the podcast and tell you about something really important that's happening. So 2020 has been designated as Year of the Nurse and the Midwife. And it's really great to be celebrating nurses and to be sharing trending hashtags. But what we really need to do is get into action, because it's up to us. And nothing is going to change if we don't make the change. So there's a movement happening, and it needs you. We're stronger together. So come join us as we disrupt the status quo and evolve our profession. It's time. We are stronger together, so let's get started. If you want to know how you can join this movement of change, visit nurseleaders.ca/2020nurse to opt in for a free 3-part video series about how we can use 2020, the Year of the Nurse and Midwife, as the year we finally use our collective voice and lead our profession forward. So jump over to nurseleaders.ca/2020nurse for all the details. Now back to the episode.
So I want to talk about Trusted Health, because when we were chatting prior to recording this podcast, you were telling me a bit more about it, and I think it's an incredible innovation. And so I just want you to share what it is and really how it's shaping the nursing profession and changing how we do things.
Yeah, so it's amazing. It's an amazing company, and our founders are just so dedicated to nursing. They're not nurses, but they have family members, close family members that are nurses, and they've built this company to really honor them. And so Trusted Health is at its core a staffing company for nurses. We have built a technology matching platform that allows nurses to put in their preferences, create a profile, put in all of their certifications and credentials and everything into our online platform, sort of like a LinkedIn for nursing. And then if they choose, they get matched with jobs. So right now our core is travel nurse jobs. So they'll get matched to things all over the country. If they want to live by the beach, they can say that. If they want to make a lot of money, we can find them the highest paying jobs. If they want to travel the world or the country, we can match them with those. And so instead of having the travel nurses deal with recruiters, they get to interact more with our technology matching platform. We've also made pay transparent, and in the old model, nurses have to negotiate with a recruiter on what their hourly pay is going to be for any assignment. We've made that transparent and upfront and broken down in what they take home versus what they get taxed on versus what their housing allowance is. And it just puts the nurse back in control. We've integrated with like Google and Yelp for walk scores and local restaurants and housing and all that kind of stuff. And then instead of having recruiters, we have nurses. We've employed nurses that have stepped away from the bedside to be that point of contact for all of the travel nurses that we employ. The travel nurses are also benefited on day one of their contract. So they get a 401k, and health and dental and vision benefits on day one. And as long as they have a contract with us, they are fully benefited, which is different than a lot of agencies out there as well. And then I think the biggest thing is we're not just trying to staff nurses into kind of open shifts. We're really focused on putting the right nurse in the right situation with the right patient. And so we're working on technology to actually really take nurses' skill sets and desires and passions and professional goals and match them with ways to accomplish those, even though they're not, let's say, a full-time employee of, a big health system. They're going to travel for, 2 or 3 or 4 years of their career. So it's been really great. We've built a whole community of positive nursing. We have a huge closed Facebook group for the nurses that work with us. We're doing events all over the country, trying to bring nurses together and really change the dialogue away from, well, I just got to get through this shift to let's celebrate this profession and what can we do to actually change it and make it better.
I love that. And as a previous travel nurse, just like how easy you've made it and taking out that recruiter. I mean, I worked with some fantastic recruiters, but I also worked with some not so fantastic recruiters. And so putting that power back in the nurses' hands, I love that concept. So I think this is such an amazing innovation. And also the fact that, you're growing this culture change alongside with it, putting nurses back into in charge of like where they're going and also helping them find that right fit. I started just a coaching program for nurses to find their right fit because so many places staff hospitals, and nursing units as 2 feet in a heartbeat. If you're a nurse, you can have a job here instead of actually looking to find what's the right fit for this nurse. And I feel like that's part of our issue in nursing right now is that we've just gone in with blinders on and we're not looking at what actually lights me up and what is my passion and how do I find that within nursing because there's so many different areas. And I feel like sometimes we forget that. So I love that that's really what Trusted Health is helping nurses do.
Yeah, it's really interesting. I mean, we're not trying to say recruiters are bad either. We're saying that they're incented wrong. They're incented to place people and make a margin on the pay rates versus the bill rate. And we think that we should pass that savings along to the nurses and to the health system. So it's just a different philosophy and it's a different model. And I think one of our recent strategy meetings, we said, hospitals will never, ever, ever be fully staffed ever again with their own people. It's impossible. They're never going to have enough of their own full-time employees. And so they have to be able to use a more flexible workforce. And we know the trend of workforce is becoming more flexible. And how do we give them tools, hospital systems and nurses, to actually be flexible and manage a flexible workforce? And so that's really our mission. So it's been a lot of fun to kind of disrupt the traditional model.
That's amazing. And I mean, travel nursing is such an incredible opportunity. I feel like that fast tracked my own clinical skills and also my career in nursing by getting out there and seeing different places and what they do and taking, the good learnings from each place really helped accelerate my own career. And so I think it's amazing that you're helping people to pursue that passion if that's something they're interested in. And I would encourage people, if you do have that kind of niggling that you might be interested, to definitely look into it, because it's such a great thing to do for your nursing career.
Yeah, I agree.
So I want to chat a bit about, because you had kind of the traditional role right out of school, right? You were working in a bedside type role, and then you pivoted very quickly into academia and the private sector. So what did that look like for you? Like, what are some skills and like, I guess I'm really interested on the private sector and business part, on how you're using your nursing skills in those type of roles.
Yeah. Stepping away from the bedside, I'm actually helping some of the nurses that we work with at Trusted kind of make this decision too. And I find it happens for nurses right around like the 5-year mark of bedside. Like you're like, okay, now what? Like I'm kind of an expert in what I'm doing. I either need to be challenged in another specialty, or I need to make the leap into management or academia or whatever the next thing is. And for me, it was more of a smooth transition, because when I did the ER work, like that was the best choice of my life. Like I am an ER nurse throughout. Like I could never work anywhere else. MacGyver is my spirit animal. And so it's always about figuring out how to fix things. And that's really kind of the ER way. But I always had my hand in that simulation world, which kind of brought me over into the academic side of things for a little while. And then the academic skill set kind of lended itself into a more corporate academic setting, which was the director of nursing education for the health system side. And then that led to the Kaiser thing. And now what was interesting when I was at Kaiser Permanente is I got to work across multiple business units, both nursing and non-nursing. And so I got to bring that clinical lens. That my first role there was that nurse expert. So we would have all these technologies come up, like real-time location services that would track you throughout a hospital, so you could know where everyone was at any given moment and track equipment and that kind of stuff. Or we'd have Google Glass, be kind of the hot, hypey thing. And they're like, well, how would nurses use this technology? I was like, well, let's think about that, and let's try this, and let's go to our innovation center and mock this stuff up. And so it was really being that clinical expert, kind of translating it into the technology world, which was a great skill set to build. And then that got me more embedded into kind of the private sector. So I'd be talking with these companies about their strategies and their product roadmaps and how they're going to, deliver these services to the end user, which was usually nurses and physicians. And so it really got me to be able to understand the business language. And then kind of all of that came together. And now in my new role, it's kind of tying all those pieces together. So, I'm helping translate what nurse leaders think about so that we can do product design and do business development. And I'm helping our nurses that we employ, build leadership programs, which kind of ties in the academic side. And we're trying to think about how we engage training differently, and that's the simulation side. So all of the different pieces of my career, whether it was bedside or academic or private, have kind of come together in this role to really just tie it all together into this system that's trying to kind of advance the profession. So it's been kind of interesting how it all comes together at the end.
That's amazing. So if somebody's interested in getting into those roles that you've held, especially, working in the technology piece as the clinical expert, how would you suggest that they transition themselves into that type of role? Or what are some skills that they could be looking to build now, knowing that they want to move forward into something like that?
Yeah, I think a lot of it is just being an early adopter of new things, whether it's technology or not, just raising your hand and say, I'll try that when new systems come up or new processes or whatever if you're a bedside nurse. Mm-hmm. That's really what I did. I mean, I remember convincing our management team to allow us to use the Palm Pilot 3 to do drug lookup, when we were at the bedside. Like just simple things like that. It's not some formal training or anything that you do. It's just being that early adopter. I think now with the adoption of medical records and the growth of the informatics kind of roles and things, and the super users around different technologies. I think volunteering for those, being a super user, being a trainer, working with the informatics teams, really gives you a good skill set around understanding the technology. And then from there, you translate it into opportunities that may pop up. You go to meetups, or you go hang out with startups, or you go to pitch events in your local area, or and you just start networking, and eventually you have that skill set of both clinical and understanding the technology that companies and groups and even internal teams find useful, and you just take those opportunities as they come up.
So do you think you could define for the listeners, because this clinical innovation role isn't something that a lot of nurses are familiar with. So can you define what that means, and what kind of the day-to-day operations, what you're doing looks like in that clinical innovation piece?
Yeah. So I'll tell you kind of the two big innovation roles I've held. Kind of, they're a little bit different. So at Kaiser, when I was the director of nursing innovation, that was really focused on emerging technology. So we would meet with all the startups and the big companies, the Apples, the Googles, and all that kind of stuff, figure out what new products they're trying to design, and then really think about how we would potentially use those products to revolutionize healthcare. And my role there was being kind of the clinical liaison from a nursing perspective to help the technology and design and teams think about what is the workflow of nurses, how do they think, what do they do, how do they use things. I would help bring them into hospitals and run pilots with our bedside nurses and all that kind of stuff. So I was really that kind of liaison. Mm-hmm. In my role now, it's more of a nurse leader role. So it's really thinking about what are the areas of opportunity within the nursing profession that really need change, and then helping our company design processes and initiatives to actually go tackle those issues. And so it's more of a system viewpoint now rather than kind of a bedside clinical point solution viewpoint. But it's really just, day to day is thinking about, like nursing leadership education is really bad across mm-hmm. health systems. And mm-hmm. so how could we use our platform to actually deliver a better leadership program? Or, new graduates don't have a place to find the information they need when they want to get their first job. So how could we build solutions and things around that? So it's really thinking about systemic issues and helping design solutions for it.
That's amazing. So are there any technologies that you were introduced to in that role that you held with Kaiser Permanente that are now kind of out there and more mainstream?
Yeah, so real-time location systems is one of them. We piloted early on these badges that nurses would wear that allowed us to see on a map of the unit where they were at any given time, which was very controversial at the time. Like, you're going to track us in the break room, you're going to track us in the bathroom, like you're going to reprimand us when we take 5 more seconds for lunch. And so really working through those issues and the data behind that, and working with actually the unions on what data could be shared and not shared and all that kind of stuff was really interesting. And then we ended up building a hospital in San Diego, a brand new hospital, and were able to use that same concept. So when, not to track the nurses wherever they were, but anytime a physician or a nurse walked into the patient's room, the picture of that nurse or physician would pop up on the screen and tell the patient who they were and what they were there for. So, it didn't take the exact kind of roadmap that we had created when we were tracking nurses and trying to help them find each other, but it was a really good patient-focused solution that allowed the patients to see, oh, that's a nurse walking in my room instead of just another person in scrubs kind of thing. So that was kind of cool. I'm trying to think. We had a bunch of them. Wearable technology, the different apps and things we piloted are in use now. We had probably like 6 or 7 really big successes from that emerging technology work.
That's amazing. I think some of the places in the US are obviously ahead of where we are up here in Canada as far as technology goes. Just locally in Alberta here, they rolled out a new medical record system for the hospitals. And once I found out what it was, I was like, I used that 11 years ago when I was a travel nurse in the States, and they're touting this as like the most groundbreaking thing. So it's kind of funny how far behind we are in some areas, tech innovation wise, within the healthcare system between the two countries. So I'm fascinated to hear all this stuff from you. Yeah. So what do you think one of the biggest challenges facing nurses today is, and how might we go about solving that challenge?
Well, that's a really loaded question. Mm-hmm. Nursing has a lot of challenges and a lot of successes, but I think it kind of as a profession as a whole, we're just we're not at the table where we should be, and part of that is because we don't ask, and part of that is because people who run the tables don't understand what nurses do at an intimate level. And so, one example is like in California. Every other profession except nursing at the moment has a bill in front of the state legislature to expand scope of practice, and nurses don't. And I think that's a problem, because as healthcare shifts, our scope of practice and our work as nurses is going to continue to change. And if we're not thinking ahead, like the paramedics and the pharmacists are, they can easily take over work that nurses do. And I think that's a huge issue. And we need to speak up more and think more innovatively about how our practice is going to evolve. So I think that's the big systemic issue. On kind of a more day-to-day issue, I think nursing education is pretty far behind. Undergraduate nursing education is pretty far behind and isn't tied in enough with the emerging technology that's going to disrupt our care. For example, I'm founding faculty for the new Kaiser Permanente School of Medicine. And we were talking about, kind of innovations in that space. And we actually talked about a day where you may never wear a stethoscope again in the future, because these handheld ultrasound machines are becoming so small, so clear, and so cheap that you could just have a handheld ultrasound machine and scan everybody almost like a tricorder. And that's your new stethoscope. And so how do you start incorporating those ideas into how you teach the clinicians of the future? And I'm not sure nursing is there yet. And so we're actually graduating people that aren't ready to enter practice immediately. And we have to supplement with all these residency and training programs. And so I think there's a gap between academia and practice at the moment.
Yeah, and in the States, now correct me if I'm wrong, but you guys, it's not a Bachelor of Nursing entry to practice. Is that right?
It doesn't have to be. You can be associates and you can be bachelors. Yeah, and now there's also accelerated master's programs, but they end up sitting for the NCLEX. So. Okay.
Yeah. So up in Canada right around the time I was finishing my education, so 2005-ish, they actually did away with the 2-year education program, and now it's all bachelor to entry practice nurses up here. And so I'm just wondering if that's part of a disconnect between, again, Canada and the US. Just interesting how different countries run their nursing professions.
Yeah, no, it's always been a debate here. Hospitals have gone back and forth with saying we're only going to hire bachelor's prepared nurses, and then they realize they can't hire enough, and so there's all kinds of dynamics there. But yeah, the States has not made that decree yet, although the magnet kind of designation work that every hospital is trying to get to is pushing, like I think it's 80% bachelor's nurses for the workforce. So I think there's some dynamics that'll push it that way, but until we actually have too many nurses, I don't think we're going to be making that decision anytime soon.
Well, and I don't think too many nurses is going to happen anytime soon. I just saw a report out from the International Council of Nurses saying we're expecting a 9 million nursing shortage by 2030, which is, 10 years away. So,
yeah.
So I just want to dig back into what you were saying about the nurse's scope of practice and how we need to evolve. Do you have any kind of ideas on what that would look like or where we need to take that? I know that's a big question too, and I'm kind of putting you on the spot, but I'm just curious.
Yeah, that's a good question. I'm definitely not a scope of practice expert. I think from a trending perspective, more autonomy in decision making would probably be a start, especially in places like home care and outpatient ambulatory care settings. I think having nurses be able to do more assessing, more medication management, and not have to run everything by a provider, a physician provider, or advanced provider, I think is a good start. I mean, what we're seeing with the other professions is like paramedics. So paramedics are now going into homes, doing complete assessments, doing wound care, doing stuff that nurses are, kind of the core of what nursing work is, and they're doing that as paramedics. Pharmacists are doing things around medication management and prescribing and expanding their scope in that way. And I don't know. I think nurses need to think about what the future of caring and being that kind of frontline coordinator of care is going to be, and actually start shifting their scope of practice to be probably more autonomous, more coordinating, and expand some of their assessment and medication management skills.
Yeah, I agree. And I really think it comes down to this push, as part of the International Network of Nurse Leaders, obviously we have this philosophy, but every nurse is a leader, but we don't act like it sometimes, or not everybody's willing to embrace that title. And so it's really, breaking down leadership to see what it is, what can I do every day, and how do I use my voice where it's important and for what matters. So not only, showing up as a leader for your patients and advocating for them, but also for our colleagues and our profession as a whole. And so getting involved in some of those professional nursing associations, politics, like you mentioned, not having a bill at your state legislative, that sort of thing, that we need nurses that have interest in that to start championing some of that work and carrying it forward. And it really starts with identifying as being a leader.
Yeah, I agree. And I think nursing doesn't have like a coordinated voice. We have a lot of associations, and some of them are even conflicting. And so sometimes nursing comes across very fragmented, and I think we need to fix some of that, especially around some of the bigger issues. We'll always have difference of opinion, but I think as a profession, especially on like scope of practice, we should have a coordinated voice. We have, in the States, we have 4.5 million nurses. That outnumbers any other profession in healthcare, and I think we could use that voice a little bit better.
I agree. So if somebody's interested in, using or seeing themselves more as a leader, they might not have a professional role or title that designates them as a leader, but what are some things they can do to really start showing leadership skills and capabilities?
Yeah, I think the biggest thing is just get involved with your local chapters of different organizations, whether it's, in the States, American Organization of Nurse Leaders has local chapters. We have Student Nurse Association chapters. There's Sigma Theta Tau chapters. So I think, you can get into that local level fairly easily and start to learn how things work and how to influence people, and how boards work, and simple budgeting and all that kind of stuff, which I think is a really good primer for moving into more formal roles. I think in the clinical setting, taking opportunities to do charge nursing, or, leading an education session around a new product or something, like those things are really good ways to step up and start influencing groups of people. And then over time, those skills translate directly into more formal roles as you move through the kind of layers of leadership.
So we've talked about, that there is going to be this nursing shortage. What do you think we need to be doing in order to attract more people into our profession and also retain the people that we have? Because there is this, people leaving the profession at that 3 to 5 year mark. You said, around 5 years are starting to look at transitioning and pivoting into different things, but there are a lot that leave the profession altogether. So any ideas on what changes we need to make in order to attract more people in and retain the ones that we have?
Well, I think the biggest thing is just we got to cut out the bullying that happens in nursing. I mean, it happens at every single level, including executive leadership roles, and sometimes it's overt and sometimes it's very passive aggressive, but it is the number one thing that I think turns people off. Yeah. And I think that the newer generations of nurses coming in are not going to put up with that, because there's so much anti-bullying work being done in their education as kids, and they're just not going to put up with that. And so I think we just need to stomp that out. In our book that we just published on innovation leadership, we have a whole chapter on toxic leadership, and my new kind of message is toxic leadership is as impactful to patients and to our profession as falls and pressure ulcers and all those quality initiatives that we have, and we need to treat it with the same rigor. So I think that's the first thing, is just make nursing attractive and not like something you have to put up with. So I think that's one. I think the other one is to be able to allow more flexibility. I think there's a really good, the culture of nursing of the 3 12-hour shifts is it's great, right? You can work three days a week and have 4 off potentially. We're seeing some data that may not be the best way to schedule people, and 8-hour shifts might make more sense. But I think just figuring out that flexibility and allowing nurses to live their mission and not just be 2 feet in a heartbeat, like you said, in shifts, and actually connect with patients and give them time back and take away a lot of those administrative tasks and get them back to the assessment and the caring side of things, I think will be the other one. And then I think the third piece is we need to think about what are all the roles nurses can play in the healthcare system, and start making those available and interesting for new grads, because I think the nurses coming out, I was just at a meeting the other day. They said no one wants to go to med surg anymore. They all want to go right into specialties, or they want to go start a business, or they want to go, travel as new grads, and so, or go into home care or whatever, which have not been traditional routes for people coming out of nursing school. And so, how do we create different pathways in a safe manner to allow graduates to do the things they actually want to do and not have to put up with, a year of med surg before they actually go do the thing that makes their heart sing.
And I mean, like, I'm 14 years in, and I remember when I graduated, I got told you have to go do at least a year of med surg before you can go into labor and delivery. And I was like, I won't be a nurse in a year if I have to do a year of med surg, So, and I mean, I was able to kind of create that myself and move around to where I got that specific role in a very short period of time. But it was, and still, I guess, is that mentality of you have to do kind of the grunt work, or that, pay your dues at these certain other roles first before you can move into what you want. And I think that's a huge reason why we're losing nurses out of the profession, instead of helping them pivot into the roles that, they went into nursing for, or they're great at, and that's where their passion lies. We're going to have much better patient care and happier, healthier nurses if they're working in environments that actually light them up, instead of just putting in their time and getting through a shift.
Yeah, and I think we really need to just challenge those assumptions, because, the meeting I was at, they were talking about, our nurse leaders really think that our new graduates need to do med surg. Well, show me the evidence on that. I mean, I went right into the ER. I was an ER nurse at the bedside for almost 8 years, and I got certified after my first year. Like, there's no reason that you have to go to med surg. The skill set's very different there than it is in a specialty area. So, and we have shortages in all these specialty areas. So let's figure out a safe way to transition people into practice, and, like you said, the places they want to go, and stop kind of going with the old wives' tale of, well, med surg is where you got to go because I did it. It's just not. It's part of that bullying culture, I think.
Yeah. So on that bullying culture, we've all heard the expression "nurses eat their young." What do you think is a root cause of that type of culture, and how do you suggest that we start fixing some of these bullying problems?
I think we just need to just have a zero tolerance policy around it. I mean, like I said, there's data on what the behaviors of a toxic leader is, or a toxic person, or a toxic team, and we need to start assessing our leaders and our teams for those behaviors and stomp it out. I think it's as big of an issue as quality indicators like falls and pressure ulcers and central line infections, and we don't give toxic leadership or toxic teams the same attention. We kind of say, oh, well, that's just how they lead. Oh, they've been around for a long time. That's just how they are. And we kind of pass it off. And I think we need to stop that and actually probably set some examples with people that are really bad, and then create tools and resources to actually move teams away from that toxic that toxic culture and get rid of people that are actually hurting others. So I just think we need to just put almost the hammer down on it, because it's just not okay. And you can see the burnout and the suicide and all that increasing in nurses and physicians. And unless we really take hard stance on it, it's just going to be that passive aggressive culture that nursing kind of lives in right now.
Yeah. So the vision statement of the International Network of Nurse Leaders is that we believe in the power of nurses to change the world. What do you think of that statement? And in your opinion, are there some social issues or platforms that nurses can put their collective voice behind to make a difference in the world?
Well, I totally agree with the statement. I think nurses are well positioned to change the world, and they can do it through healthcare. Nurses are the center of and the coordinators of really everything that happens within the healthcare arena. So we're positioned in a way to influence almost every part of the system. And so I think we need to step up and do more influencing in those areas. As far as where do we start, or what platform we can go to, I think it comes back to getting a more coordinated voice around issues that all nurses can agree upon. I think part of that would be expanding scope of practice so we could help patients in some of the ways that they're not being helped, whether that's being seen faster or getting social needs met or social determinants or those type of things. I think the other place where nurses can do a better job of being at the table are in the non-traditional healthcare innovator tables. So like Apple, Amazon, Google, Facebook, all are entering healthcare, and nurses are nowhere really to be seen in those companies. Although Amazon has a few. They're always hiring physicians, and I think nurses need to step up and say, here's what I can add value to as you innovate and disrupt the healthcare system. Let me be at the table with you because I have a viewpoint that can really make you successful. And I think we can lead through some of these non-traditional disruptors as a platform, and we just haven't been there.
I think that's great. So what are some things happening today that make you really proud to be a nurse and proud of where our profession is heading?
I'm always proud of nursing. I mean, just the things we can accomplish despite the larger healthcare system being really kind of broken. And the fact that we can deliver amazing quality care and just these stories that come out. One thing our company does is we have a Slack channel that's called Good Vibes. And so we put on stories or text messages or posts on our social media sites that nurses that we work with tell us about their day or their work assignment or whatever. And there's just so many awesome stories about nurses going above and beyond and doing just amazing things, especially in natural disasters and all those type of things. Like, you just see nurses rise to the occasion, and it always makes me proud to be a part of that. And then just speaking all over the country and seeing nurses really trying to build more businesses and create products and be disruptive. I think that's super exciting to see that start to flourish. And I'm just really excited to see where nurse entrepreneurs will lead us in the future.
Mm-hmm. Yeah, I think there's a really big transition right now happening where nurses are seeing that being nurse entrepreneurs is a viable option for their nursing career. And I think that's only going to grow. So it's really exciting to be watching. And, patients are the ones that benefit from that because they're being able to access healthcare in a different way that maybe meets them where they're at a little better than our traditional systems.
Yeah, agreed.
So Dan, as a leader in the nursing profession, what change do you hope to impact over your career? Looking back at the very end of your career, which I know is many, many years from now, what would you like your legacy to be within nursing?
I just like doing really fun, impactful stuff. And so that's a horribly vague answer, but I think for me, if I could help shift the idea that leadership is learned through on-the-job training and transaction between people to leadership is a way of influencing people and teams to be high-performing and thrive in the system they're in, I think that would be really cool. And if I can, influence people to have that mindset and to go out and make changes and just really create a better culture of nursing, I think that would be a cool legacy. And I think on the other side is just, I hope that I can build, or be a part of some sort of innovation that is really game changing for healthcare, whether that's what I'm doing now in the staffing agent world or something that I have no idea that's coming up in the future, but really just pushing those assumptions and traditions a little bit further and challenging them and creating something that's just really cool and disruptive.
That's amazing. And I think you're definitely already headed in the right direction and probably influencing more than you know. So thank you for being here with us today. Was there anything else that you wanted listeners to know about, or any causes or anything you wanted to bring awareness to before we wrap up today, Dan?
Yeah, just a couple things. So one, if you're interested in the innovation work and you see yourself as wanting to get into the influencing of change, whether it's at a bedside, a system level, or going into the private sector and creating a company, we have built a master's program at The Ohio State University called the Masters in Healthcare Innovation that you should check out. It's an amazing program with world-class faculty. It's interdisciplinary, so you don't have to be a nurse to do it, but it teaches you some of those skill sets. And so would just say check that out. And then if you aren't quite ready to go back to school but like reading, we just published a textbook called Leadership for Evidence-Based Innovation, and it's the second edition. And it highlights a lot of the topics that we discussed today, including toxic leadership, leading performance improvement versus innovation, and all the emerging technology that's happening in healthcare. So if you're interested in that work, that book is out as well. So those are just some resources as you're thinking about different career changes.
That's amazing. And we'll make sure that all of those are linked in the show notes, as well as all the ways that you can contact Dan or get in touch with him on social media as well. So we'll make sure that that's all linked in the show notes and available on the nurseleaders.ca/podcast page. And you just click on Dan's picture and all of the information will be there to check out how to connect with him and also all the resources that he's mentioned today. So, Dan, I would like you to provide listeners with 3 tangible takeaways or 3 pieces of advice that you have for them.
Say yes when an opportunity comes your way and it feels right. Go with your gut. Always challenge the process and don't accept things the way they are, because everything is negotiable. And be a positive deviant. And a positive deviant is someone who thrives in a system that's failing. And so if you can figure out a way to thrive despite everything else falling down around you, you're a positive deviant, and that's a source of innovation for people. So own that and be that, and just go with your gut.
I love that. That is great advice. A positive deviant. I love it. We'll have to hashtag that and get it out there on social media. So, Dan, in closing, can you tell us a story from your nursing career that's had an impact on you?
I have to think about that for a second. There's so many. I think the most impactful ones for me have been in my early clinical days, where I have helped people die. I've helped people who were at the edge of death survive. I mean, all of those always come back. And so no matter what role that I have taken, I always think back to, what are we doing this for? And it's for the nurses providing that type of care at the bedside. And all the stress of business and deadlines and all that kind of stuff kind of fall to the wayside when you think about, that no one's going to die if you don't make that deadline tomorrow. And it just gives you perspective. And so that I always reflect back to the clinical care and the people delivering the clinical care as kind of the source of energy whenever it's been a rough day.
That's amazing. So thank you so much for taking the time to be here with us today. I really appreciate all your insight and all the advice you shared today. Thank you for taking the time to be here with us today.
Yeah, I really appreciate it. It's great. Oh, I forgot to mention too, I have a Canadian connection. My co-author for our book is Sandra Davidson, who is the Dean of University of Calgary. And so for the Canadian listeners, go check out University of Calgary, as they have a lot of cool innovation stuff going on as well.
Yeah, that's where I got my Bachelor of Nursing from. So good shout out to U of C. Awesome. Thank you so much for taking the time, and thank you everybody for listening. Like I mentioned, all the ways to connect with Dan will be listed in the show notes. Make sure to check that out, and have a great day.
Hi, nurses. I hope you enjoyed that episode of the Shift Change podcast. I want to take a moment and talk to you about something really important that's happening this year. As you probably know, World Health Organization designated 2020 as Year of the Nurse and Midwife. And while it's important to celebrate the nurses and participate in all these events that are happening, we need to make sure that we are being strategic about making this the year that we really use our collective voice to raise the profile and status of nurses and advance our profession. Understandably, some of you may feel resistance to this call to action. After all, how can we expect nurses to raise the profile and status of nurses and advance the profession when oftentimes nurses aren't even getting a proper break to sit down, eat something, or even use the bathroom on their shift? But you know what? If we don't act, and act now, nothing will ever change. No one is coming to save the nursing profession from the burnout and exhaustion, from the staffing crises and nursing shortage, from the violence and bullying, from the budget cuts, and all the other threats to our profession that we are currently facing. Only we can save ourselves. And that can only happen when we decide enough is enough. We must decide that this is the year that we are going to use our collective voice to shout our value to the world, to introduce innovative and revolutionary ideas into healthcare, to advocate for our patients and our profession, to shed the just a nurse mentality and claim our position as leaders, and in doing so, change our profession. This year, 2020, Year of the Nurse and the Midwife, you get to decide. Is this the year that everything changes? Is this the year that we finally say enough is enough and break through the status quo? Is this the year that you, yes, each one of you, decide that you are tired of just complaining and actually put in the work to make a change? Because the truth is, it is up to us. And nothing changes if no one changes. Let me say that again. Nothing changes if no one changes. There is a movement happening, and it needs you. We are stronger together. Come join us as we disrupt the status quo and evolve our profession. It's time. It's our time. We're stronger together, so let's get started. If you want to know how you can join the movement of change, visit nurseleaders.ca/2020nurse to opt in for a free 3-part video series about how we can use 2020, the Year of the Nurse and Midwife, as the year we use our collective voice and lead our profession forward. So jump on over to nurseleaders.ca/2020nurse for all the details. I'll see you over there. Thank you so much for joining us today. If you love the advice shared on this episode, we would be so grateful if you would let us know. Please head over to Apple Podcasts, formerly known as iTunes, and subscribe to our show, and then rate us and leave your review. We would be so grateful if you would take the time to subscribe, rate, and review. While you're on our website, nurseleaders.ca/connect, all of our social media handles are there, and we would love to get to know you on social media as well. Thank you again for listening today, and remember, nurses, we have the power to change the world. Let's start today.